So then there's also the challenge that we talked about, mental health, which touches everything. I know that if you are stressed, if you are overwhelmed, if sometimes you are under or overweight, either extreme for you, remember the body is a very good slave. It's going to focus on your health. Your having offspring is a second last thing. And it's interesting how your body sometimes is informing us that maybe that's how we should look at all these things. So if you're in a family where, let's say, you have a family member who has any kind of pathology, you have to obviously consult with your medical professional. They may need to start checking you way earlier. They may need to start checking you in 40, right? But not later than 45.
Wow. Do you ever see rare disease patients of the female and the male with prostate, or the female we've actually covered already with the menopause? A patient living with a rare disease condition and the prostate at the same time.
Yes.
And how do they navigate around that in terms of the survival mode, especially when the prostate is not going anywhere? As well as the rare disease condition they're living with.
You know, the truth be told, remember what I was saying, that the vast majority of people will never meet a neurosurgeon. To some degree, most of our patients qualify as your rare disease patients because it is so uncommon for you to end up having something that is of a state or of a severity that it needs a neurosurgeon's intervention.
Yes.
That's the first thing.
Hello, hello, hello. My name is Satram Blair, and hey, welcome to Khobe's Health Century podcast, where we talk health, physiological part of our bodies, and of course, the mental state. And Khobe's Health Century podcast has partnered with Rare Disease South Africa, where we represent guests who has debilitating symptoms, which varies from one symptom to another, the causes, the treatment, the diagnosis, the life story, the journey, the anxiety, the state of the mental health, the family support, and just knowing that tomorrow for them may never come. And what do they do best is to live for today, because the present moment, it's very important. I'm so excited. Today I have a guest. Her name is Dr. Wilheminah Makhambeni. She is the neurosurgeon, and she's going to enlighten us, educate us, and tell us more about her role. Dr. Wilheminah, welcome.
Thank you so much for hosting me. It is really a pleasure and an honor to be here this morning.
Yes, I'm so excited. We spoke about this, I think it was a year ago, and eventually...
And it's happening. Look at you doing this, hey?
I'm telling you. One of my first question would be, please tell us, who is Dr. Wilheminah?
So I am first and foremost a humanitarian. I'm a medical doctor, and my specific field of interest is neurosurgery, which is essentially a study of any structural and sometimes traumatic disorders of the brain and of the spine. And we can go into more detail as we proceed, I'm sure.
Wow. So we're talking about the brain and the spine. I'd like to bring something while we're talking about the brain. This is an experience I once had before. When I was a lot younger, I suffered a lot from migraines, and I remember it was very frustrating because it was days before technology took a great hike. And we didn't have much answers because Dr. Google was not there, because most of us, we kind of like happy these days. You're looking for something, you've got an ache, a discomfort, a pain. You just run your fingers through the cell phone, And what happened is with these headaches that I used to get, migraines, I remember I used to go to sleep, not knowing if I'm going to wake up the following day. And I took absolutely everything you can imagine. We used to take Grandpa, Panado, and literally that's it. And some of my family, they said, maybe it's best for you to go and consult so that you can see an African traditional healer and see what's going to happen. Of course, they took me through down that route. I've tried that, and on the other side, you're praying, you're saying, if the Almighty can be with me because I'm still young, I want to live, and we just didn't know what was happening. I had to go through the headache clinic and I went to different ones. I remember eventually I was referred to go and see a neurosurgeon. Getting there, interestingly enough, my, I would say, professional neurosurgeon only saw me for a few minutes. I was so excited because to me it was like, thank God, this is the ultimate answer I was looking for because I've done everything. During those days, nutrition was never hyped up. It's something we never used to speak about. We didn't really know much about different kinds of why is nutrition important to us and that the foods that we consume, they actually play a vital role in our hormones because I was a young girl growing up, in absolutely everything a physiological body. And I struggled. Having been to see the neurosurgeon, right? No, sorry, the
Neurologist.
Neurologist, that's correct. I remember walking out of that office and all he said after he'd done all the tests, I was told that the size of my pituitary gland, it's growing more than its normal size.
Yes.
I didn't know, what's that?
What does it mean?
What does it mean?
Where is it?
Absolutely.
What does it do?
Exactly. What is the pituitary gland now that we've started with this story? Because I would like it to be an awareness to someone out there before we get into your role, into further details. What is the role of the pituitary gland? Because I walked out there not understanding what it is.
And what they meant.
Absolutely.
Right? So the pituitary gland is literally one of your hormonal centers in the brain. It works in correlation with a structure that is just above it. It's if you were to look at a person, it's almost going to be behind their nose, right? Behind the bridge of their nose. That's how we access it anatomically, just as a rough idea, between the eyes, a little bit behind the nose. So that said, that structure under normal circumstances sits in a cavity and it lies within that cavity. It receives information from a section just above it. It's called the hypothalamus. And this now forms essentially a feedback loop, which also reads what's going on peripherally in your body. Because those two structures essentially send out the signal of what a lot of your hormones should be doing. Should we be excreting more? Is it time for you to ovulate? Should your thyroid be functioning to a certain degree? Are you responding to stress and your cortisone levels? Are they where they're supposed to be? So the reason I'm saying it's a feedback loop is that this will give the body an instruction and then it is able to pick up based on the amount of the hormones in your bloodstream that, okay, we are overreacting, we're underreacting, we need to work harder, we need to work slower. So all of these things are connected. However, you will have different kinds of either pathologies or slight deviations from what it's supposed to do. So one of the most common disorders actually is called a pituitary macroadenoma, right? Wow. So as you stated that it grew a little bit larger than it was supposed to be. It's not necessarily cancer. Yes. So sometimes they're normal cells. Unfortunately, there are few too many of them. And if it's severe, right? So those are the cases where we have a bias market, by the way. So the ones that will come to us are the ones where it has overshot to, let's say, the 5 or 10% that are walking around in the community where it's causing absolutely no problem, right? And now you have that person where it is now pushing against, remember I said it's between the eyes, where it's pushing
Yes.
against the nerves that are supposed to be picking up what you actually see, and therefore causing visual disturbances, or it's causing such significant hormonal imbalances that we actually need to treat that. In many patients' instances, it's asymptomatic. It could be a mechanical issue, because remember, there are nerves that also supply different zones of the brain, including the lining of the brain.
Yes.
So you might find that there's an irritation there, or remember what I was saying about its influence on how hormones function. So you could find that maybe it's causing some level of hypoactivity relative to your general normal state of what the blood vessels, the caliber of the blood vessels are, and that can also be an irritant for our bodies. So we will see as neurosurgeons the few ones where the size is just so overwhelming that we need to deal with its impact on the adjacent important structures like the nerves that receive information from the eye, or it's a hormonal imbalance where, despite medical treatment, the only way for us to balance you out, to minimize the potential dangerous impact, is for us to literally either to cut it out or to decrease its size. So, but very few people fall into that category.
Oh, I'm so happy because I didn't have to go through that in the end. So mine could have been hormonal, because I remember my menses stopped. Then I had to see the gynecologist, and endlessly I had to do those visits. Eventually he put me on a pill, and then that's when my menses came back. And however, the discomfort continued. Eventually I went to go and see the ENT. When I saw the ENT, I was fogging medication nonstop for a very long time, 4 years. Eventually I felt, because I used to count them and say, is my life going to be dependent on these pills on a daily basis? For how long? So the biggest question for me was, for how long? I used to be in agony to say, what have I done? Why me? Self-pity, you know?
Yes.
And I remember at the same time, while I was going through my own self-pity, some members of the family, they started naming me that I'm hypochondriac, which was very sad because they were not close to the pain which I was going through.
And anxiety.
And anxiety, of course, you know. So I'm very happy. I'm so glad, because for the first time today, I know what I had. I just, didn't know much. And I'm glad that I had this opportunity to ask you this question. What does your role entails on a daily basis? What do you do as a neurosurgeon? Some of rare disease patients, the guests that we've had on the studio that we've already interviewed, they've seen professionals like yourself, which is why I had the interest in saying, I would like to interview you. Because when they came to mentioning your name, I could see your speciality. I could see in their eyes so much sorrow, because they felt like it was their last hope. Yes. And they don't know how they're going to walk out feeling as,
or even avoid it.
So true.
So, let's start with your example as a way of navigating the question, right? So as an example, it's not necessarily what you have. You'd have a prolactinoma, which would be, one of the sorts of your adenomas that you could deal with, right? The macroadenomas, where maybe they give you literally something to deal with that hyperprolactinemia, which is what's going to, interfere with your menses, which is going to, some people will have galactorrhea, where they literally have lactation, which is outside of pregnancy, as part of their manifestation. So part of my job sometimes is recognizing those patients where maybe they don't necessarily have to resort to surgery. So someone noticed that there is a mass, there is a structural abnormality, but not all structural abnormalities are best suited to surgery. So that's the first question. What's the appropriate fix for what we believe the person has? And it's never a one size fits all, right? So even though I love what I do, I get very excited just walking into a theater and the lights are on and we're wearing our masks and there's blood squirting and bone flying. That's my happy place. But ethically, it is my duty to just double, triple check that is that the appropriate corrective measure for what we're actually looking at. So in my instance as a surgeon, you actually have to go through slightly high, you have to reach a higher threshold, right? So I need to see you clinically. I need to look at the scans. I need to come back and look at you. And in certain instances, we need to try to apply medical treatment. There's some patients where unfortunately they reach us where it's an emergency and we need to act quickly. But where we have the luxury, we actually explore what we call conservative treatment first, right? Whether it's the medication, whether it's changing maybe your lifestyle a little bit, whether it's physical therapy, whether it's counseling, right? Because all of those things are related. The moment you hear neurosurgeon, we understand you are going to be afraid as a normal human being. Am I going to look like I did before?
Yes.
Do I have to be here?
Absolutely. That's what I used to have in my head.
So that is where we, as part of the journey of confirming our diagnosis, it helps us build a relationship with you, build some level of rapport with you, because you are afraid enough. Then you're dealing with the stranger. Then you're questioning what I'm actually trying to achieve, what's my agenda. As a normal human being, you meet a stranger, we're all going through a calculation of, are they for me? Are they indifferent? Are they against me? We don't know, right? So as you and I get to know each other, as we're navigating this issue, it does help to some degree that as part of reaching that threshold of whether or not I'm allowed to perform surgery, and I'm offering you the various options, and one of which is no thank you, by the way, because it's all up to you. If you do not prefer for us to go the surgical route, you say a simple, respectful no thank you, right? So as we are navigating that with you, because it takes a little bit more time, again, terms and conditions apply. Emergencies are emergencies. We still engage you though, right? We still engage you or your family if you cannot speak on your own. So we try to understand what you would like, how we best help you reach your goals, but also give you context about whether or not what I offer or what you would prefer, where do they come together? What is healthy for you? And then we take it from there.
Wow, this is enlightening. It's like, because the minute we hear the word neurosurgeon, the heads start buzzing.
Of course.
Buzzing with fear, buzzing with doubt, buzzing with lack of knowledge, not knowing if we're going to wake up from that surgery room being alive, or even after it has been successful from the moment of the procedure. How long is the person going to live?
The recovery.
Absolutely, the recovery, and I like the fact that you spoke about the importance and the correlation between the work that you do and therapy.
Absolutely.
Changing of the lifestyle, which is so important, because we live in a day and age where health matters, health issues are still disregarded by the people of our society and community. When you speak health, it's like you're speaking about a boring subject. But when you speak entertainment, that's what we want to know more and best. We only get a wake-up call only when one of our family members have been diagnosed, or if ourselves, including our kids, they are sick. That's when we actually stand up, because now we're looking for a quick fix me, thinking that there's a quick fix me. And I also like the process that you take the client or the patient through. through talking them and putting them under different medication for management before the actual day of the surgery, because not only does it give them hope, but it educates them about the state of their condition and their family as well. Because what we need most, I like to believe that it's a support system, which is what we lack, because when we don't see the physiological part of the person from the extrinsic, that they're actually ill on the inside, we take it for granted unless they've been given days, to say this is the only period you've got to live. You touch base on some patients would say, no, thank you to surgery.
Yes.
Do they ever survive?
Well, there's a wide range of disorders that we treat. And there are those instances where it is genuinely, there are multiple potential outcomes, multiple potential options. So obviously my training is biased towards the surgery.
Yes.
But my duty is, okay, given these options, here are the surgical ones, here are the non-surgical ones,
Beautiful.
and nothing still remains part of your options, right? You can still choose not to even do the medical physical therapy or the so-called conservative ones. It's still literally your prerogative what you choose to do. What we always try very hard to build with our patients is, as much as possible, a relationship where they feel appreciated, they feel respected, because when you say no thank you, there are different kinds of no's. There's still the no where you leave the door open for us to support you, for us to try to help you. Because remember, we're all allowed to also change our minds later and say, okay, maybe I actually want it, because let's explain the following. What is acceptable to me and what is acceptable to you may not be the same thing.
True.
So for some people, they may be so concerned about the potential risk that they say, okay, I haven't lost so much of my function. It's not unbearable for me yet. So we literally need to keep watching it with you, how much function you lose, how much do you understand what it is for you that is the line, the threshold of being able to say, no, thank you. But I'll give you a very good example, though. You asked the question, so what are the outcomes? What we do know for a fact is that the younger your patient is, the healthier your patient is, the better they do, no matter what kind of fix is required.
Wow.
Whether it is a lifestyle correction, whether it is a surgical procedure.
Okay.
One of the most common things that we deal with is backache, neck pain, right? Let's go through the range of why it's so common.
And these are the two things you can take for granted.
You take
You'll
for
just
granted.
think that it's minor stress that you can...
Which is quite often the case. So people under 25, we're not expecting to see significant changes when we do an X-ray and a scan. 25% only fall into the category where, okay, it's significant, right? When you get to above 40, now suddenly it becomes 50%. You get to 60, 85% of people are starting to have significant changes on their spine, right? So sometimes it's a function of how long we live and the fact that we take good care of ourselves in our younger years, that certain things catch up with you, right? So if you are a healthier 70-year-old versus someone who's maybe not been that proactive about their lifestyle, about taking care of myself. That said, I know that if you need surgery, not everybody needs surgery. If you need surgery, your risk is higher if you are the unhealthier 70-year-old.
Like that you've mentioned this.
Right? So part of what we sometimes also do is that when you come in and there's something that I can fix, I'll give you an example. You can feel your legs. You can move your legs. So you don't have weakness, you don't have numbness. Your back is very sore. But we see that maybe on the scale, you're a little bit on the heavier side, or you haven't been exercising that much. We're going to start off with that. Let's get you a bit of physiotherapy. Let's get you moving. Let's see what we can do about your eating plan. Maybe you have a thyroid problem that is hampering you from being able to reach a safer weight, right? Because no matter what you look at, everybody can look fabulous.
Yes.
But when your body starts complaining, I owe you trying to maybe reconsider what you and I consider safe for you, right?
Wow.
So we start off by trying to deal with that if we can, if we have that luxury that everything still works, you're uncomfortable.
Yes.
I can put you on medication that helps you with the pain a little bit, but my aim is not for you, is for you not to necessarily live on that forever. So sometimes the medication can buy me time as we are implementing the physio, the change in nutrition a little bit, the lifestyle fixes.
Yes.
Sometimes it's literally muscle spasm.
Wow.
Physical therapy, suddenly you feel like a new person, right? Minimally invasive means suddenly you feel like a brand new somebody. So the vast majority of patients, even those who are above 60 and fall into that 85% where you have changes in your spine,
Yes.
that require, that end up seeing a GP. Not necessarily everybody gets to a neurosurgeon. Most of those patients we can actually attend to and help effectively without resorting to the final analysis, which for most people will be the surgery. And even that said, right, you get to the place where you need the surgery, etc. As you said, it serves a purpose for us to get your buy-in, where you get a demonstration that we don't cut you just for sport. You can follow your own journey with us as we have tried the range of conservative things that may or may not have worked. But we know that we have to help you also emotionally deal with the stress of that.
Comes with that.
Because pain, we know, is associated with depression.
Yes.
But it also works the other way. If you are super anxious, your likelihood of having debilitating back pain, debilitating spine-related pain, even though you're not having a nerve crushed, you don't have the cord being compressed, the risk of that is significantly higher. So we need to sometimes deal with the mental health picture. And with mental health, we know creating safe spaces is very important.
Wow.
So we try our best to do that for you. And it's never something sometimes that you can pick up within the first 5-10 minutes.
Oh.
You have to invest the time in doing that. And I do have the luxury of being a specialist in private practice where I can spend that time with you.
Interesting.
Whereas where you have, the large numbers, you're a GP, you have a queue outside and there's a baby crying in the waiting room, that's a different calculus altogether. But the role that the GPs play is essential for us. Why?
Yes.
It gives me that luxury because they're going to weed out the ones who don't need to see me at all. Vast majority of people will never meet a neurosurgeon in their lifetimes.
It's so true.
And that's how it's supposed to be.
Oh,
that
is so
it's
true.
Supposed to be. So it's
Wow.
subset that needs to see us. Your GP will have us, most of our colleagues are able to reach us and get some advice because sometimes it's a difficult, challenging case, but with just a little bit of tweaking of what we're doing, we're able to overcome,
Yes.
the bulk of the challenges. So that said, I encourage our GPs being able to chat to us because if we're able to efficiently take care of those patients that don't need a neurosurgeon,
Yes.
it creates the luxury for me to spend the time with the ones who need a neurosurgeon. Because I better have thought very long, hard, and reviewed you before we get to the assumption that you have to go to surgery.
Yes.
I owe you that much.
Wow. Oh, I've learned so much within this very short period of time. And I'm so happy that for those of you who'll be watching the podcast, you're also taking in on so much information, which is going to help you at home. And especially for the patients living with rare disease conditions who have already seen the neurosurgeon or who have been referred to go and see the neurosurgeon. This is enlightening to all of us. We need to wake up when it comes to the matters of the health and educate ourselves constantly. My next question. We live in a life whereby we're seeing a lot of changes in terms of education when it comes to women and the hormones, women getting to the stage of perimenopause,
Yes.
menopause, and postmenopause. Do you have any patients at all who comes for consultations who are going through these three stages, who may or who have been affected by any condition which requires them to ultimately be referred to you,
Yes.
to come and see you? And what are the common symptoms? What is happening in their mental state?
Yes. So remember, they're going to be those patients who end up seeing me but don't necessarily need the surgery, right?
Yes, yes.
So I essentially form a part of the team that's taking care of everything that's going on. So you've mentioned headaches.
Yes.
Everybody has looked at everything under the sun, and maybe there's a little bit of a something that suggests that, okay, maybe they need to see a neurosurgeon. The good news about menopause is that when it comes to benign tumors, so the tumors where we say that, okay, its issue is that it is growing and it is expanding rather than it is infiltrating and corrupting the tissues around it, rather than that it is going to be able to spread in your bloodstream to other areas and metastasize. So the second group would be more like your cancerous type tumors. So for your benign tumors, some of them actually shrink post-menopause. But we just so happen, because of the hormonal changes and your body firing in different ways, maybe we do your scan and they say, oh, okay, here's a meningioma, right? Meningioma is one of the most common benign tumors that there is. Close to 50% of your benign tumors are going to be a meningioma.
Yes.
A lot of people are running around with a meningioma without a problem. They don't even know it's there because of where it happens to be. If it's sitting in a fairly favorable place, it's going to grow there and not even be aware of it. So again, it still goes back to the fact that, is this a person who requires a surgical fix?
Yes.
Because sometimes if it's not interfering with your vision, if I can help you attend to the headache without needing to cut the tumor out, we start there. If it's not interfering with your functioning, right? You're not having weakness in any part of your body. You're not having a loss of sensation in any part of your body. Then we genuinely, first of all, consider maybe we are seeing this in the context of a headache related to something else altogether, right? So again, you have to do that back and forth to determine, why am I looking at you? And is what I see on the scan what you're actually here to fix? Because as I said before, there is what you expect of me, and that is what I can offer. So I better understand what it is that actually brought you here and not assume what that issue is, right? So that's the one common thing. The other thing that we also understand is that cancer is a growing concern among all people as people are getting older. And we know for sure, when it comes to secondary brain cancer, by secondary, I mean, remember I said that there's the benign tumor like a meningioma, which is one of your more common tumors. It grows there in the brain, literally, right? It comes from there.
Yes.
However, it is more common for us to find secondary tumors. By that, I mean, it is a spread from your breast cancer, your cervical cancer, your skin cancer, your lung cancer, so the colorectal cancer. So those are the 5 most common forms of cancer in women that we come across. We know that if we help you deal with your lifestyle disorders, if we help you deal with your risk factors, we will in fact minimize your having a metastasis. Remember what I said, where the cancer has gone into your blood or gone into some other mechanism that spreads through your body, and we find it remotely from where it started. So it starts in the breast, we find something in your brain, right? So we know that in those patients, it makes a night and day difference whether or not we do your screening. So please, you need to go for your pap smear. Yes, I'm talking about the brain.
Yes.
But if we deal with your cervical cancer, you need to do your mammogram. I'm talking about the brain, but if we brain and spine, but
Yes.
if we deal with your breast cancer and your risk, it makes my life a lot easier. Lung cancer, if you avoid smoking. Colorectal CA, you go for your colonoscopy screening when it is appropriate, and more importantly, you also, be healthy when it comes to what you eat. You have to ensure that, are you drinking enough water?
Yes.
Are you taking enough what we would call, roughage, just to, put it in a layman's term?
Yes.
Are you taking enough fiber in that will help your body process all these things that we consume and minimize your risk?
Yes.
Are you eating food that is less processed?
Yes.
Small things that make a significant difference. If you have a familial risk factor, right? So you find that you grow up in a family where your mother reached a certain age, 40s, 50s, she was diagnosed with breast CA. You have a sister. So are we proactive about dealing with those sorts of risk factors? We're not saying that everybody needs to have a double mastectomy. No.
Yes.
Let's get with reasonable things. It doesn't have to be extreme. But we know that if we take care of the postmenopausal lady holistically, she ends up seeing a neurosurgeon way less. And remember, I talked about anxiety.
Yes.
If we help you deal with what you're going through emotionally, because menopause does have an emotional impact.
Yeah.
Right.
It does. And I can imagine menopause paired up with a rare disease condition and is one of your patients, then it becomes overwhelmingly, yeah.
So the counseling is part of it. And your moving, your exercising can actually minimize our requirement for all these things. Why? You get
Mobility.
an endorphin boost.
Yes.
So that is going to be your most natural, that's going to be your healthiest anti-anxiety, antidepressant that any of us can have, because it's generated from within as a healthy response to something else that is also healthy, which is getting you moving.
Wow.
And I do not need for you to do extreme sport. I don't.
Okay.
Literally 30 minutes a day, 3 times a week is more than enough for me.
Is there any specific particular kind of exercise you would mention?
So the most important thing is make it such that it gets you moving a little bit, blood pumping a bit, so it's moderate, right?
Yes.
If moderate for you means walking a bit briskly for 30 minutes, that's good enough. But remember, that's moderate for you. You're going to get fitter.
Yes.
So then maybe you can do a bit of cycling.
Okay.
Maybe you can do a bit of swimming.
Yes.
Right? Maybe you can do resistance. Maybe you are super fit. You've been going to gym your entire life. So maybe you can actually handle adding on a bit of resistance exercise. But we always say that, first of all, we need you to start. So if you've never done any kind of exercise in your life before, give me 10 minutes. Give me 10 minutes regularly. Give me 10 minutes every day for 5 days. And just add 1 minute.
Yes.
Add 1 minute for every week that you've started your 10 minutes.
Wow.
Whether it's going to be walking, whether it's going to be cycling, whether it's going to be swimming. Obviously, we're not going to talk about the super fit somebody who is a gym bunny, because they're doing more than their 120 minutes, 150 minutes a week, more than their 90 minutes to start with. Remember I said baseline? Give me 90 minutes. So they're overperforming. I'm not talking about that person. Please never ever believe that it's too late and you can't do anything.
I like that. Never believe that it's too late.
Never
You
believe
can't do
it.
anything.
Because I promise you, when you're sitting in the house, let's say we were talking about, perimenopause, postmenopause, maybe your children are getting older, they've left the house. Maybe your level of responsibilities and things that you are up to, because they are more mature, is less. Now you're sitting there feeling like an empty nester.
Yes.
Please start moving.
Find a group, a clan.
Find a clan.
Start one.
Sometimes you're overwhelmed. You've just seen too many people today and you just want some quiet time.
Wow.
So find a way of making it work for you,
Yes.
but get that endorphin boost going.
Yes.
I guarantee it's going to mean you see less of me. Maybe this is bad for business, but it is true.
we need to hear
But
this.
it is
You know, the cost of living is too high.
the support structures for us, neurosurgeons, doctors, etc.
Yes.
Twofold. Your nutritionists, your biokineticists. Why? We take for granted those two things that we do the most commonly without ever seeing a doctor. You have to move regardless.
Yes.
You have to move regardless. You have to eat regardless of what's going on.
And the food we consume, they're filled with toxins and chemicals and parasites. So you can imagine how that adds up as well.
So all those things, you put them together. We start intervening at that point, right?
Yes.
We get you moving in the right way. So let's say you're getting your 10 minutes in, right? You want to do something a bit more challenging, but you feel a bit nervous about what challenging looks like. You're a bit worried because you don't want to hurt yourself. I don't want you hurting yourself.
Yes.
Right? Visit your biokineticists. They are some of the most underutilized and most important members of our community. Visit your dietitian, your nutritionist. They're some of the most underutilized and most important members of the community. And this is how they're going to also help you. They're going to help you apply those small, gradual fixes that I was talking about. That 10 minutes every day, that slight change in how you're going to prepare your food, where you're going to buy your food from. Fortunately, we're at a point where if now you're not into cooking, you do have healthy alternatives, but you just need to reconsider how you're going to use those, right? And if you are a foodie, it does not mean that it has to be unpalatable. It's not true.
So true.
So you can get the right kind of advice that, as I said before, we intervene at the prevention side.
Beautiful.
With the things that you have to do anyway. You have to eat anyway. You have to move
it's a wake
anyway.
Up call, yes.
How are you sitting? Small thing.
Walala wasala, it's your health.
Small things. What's your posture like? What kind of exercise are you doing? Is it possible that the aches and pains you're doing, maybe we need to just adjust the exercise you're doing? Not stop exercising, just adjust. Maybe it's possible that because you've overused certain parts of your body, because all of us have things we enjoy. There's nothing wrong with that. So now you've tended to overdo a certain kind of thing. A biokineticist is going to sit with you and say, okay, let's try and keep you moving. You say you like the following 1, 2, 3, 4, 5. Here are the options, because that exercise is what they do. You do not have to figure it all out on your own.
By yourself.
You don't have to. Nutritionist, okay, what type of food do you enjoy? What taste do you enjoy? Okay, what are our targets? Where are we starting from? Are you diabetic? Do you have high blood pressure? Where are we starting from? Okay, let's work. Do you have cholesterol, dyslipidemia or high cholesterol? Okay, let's work with what you have, where you are, and start gradually migrating to a certain kind of lifestyle. And a palate can be trained. Just like you can physically train your muscles, you can train your palate. Doesn't have to be overnight.
Wow.
And these things help that menopausal woman, what you eat, how you're moving, as you said, sometimes it gets you engaging socially because maybe part of your issue is the isolation. We know that is part of sometimes mental health, that you're just lonely.
Right? Absolutely. That is so very important.
So
that's
again,
social.
Empty nester, your kids have left the house.
Connection.
What now? Your entire existence was around either work and coming home and feeding these people who are reliant on you. And guess what? Now they're out there. You've been successful. They're independent. What about you?
Because that's when life starts, actually. Even now, I know I'm kind of like digressing. I was reading an article they were talking about for people who are aging, it's never too late to even change their career, because that's when they blossom better. If they thought the light was dimmed, that's when they actually come out better people, because now the kids have left the house and they have time,
time.
So interesting. Very informative. Men, there's an increasing number of prostate cancer
Absolutely.
amongst men.
Yes.
And there's denial, acceptance, understanding, lack of knowledge and education, and resistance because of many reasons, because of culture, preferences, because of religion, because of just personal preferences. Are you seeing the rise on your door from men coming to see you because they have issues of any chronic illness, which centers around the job that you do, including that they also have a prostate cancer?
What we're happy about is that not all prostate issues are prostate cancer per se. Right. But what we do know, the good news, the beautiful news about prostate cancer is that it is amenable to very effective surgery, very effective treatment, and sometimes you don't even get to the surgery. There's something called brachytherapy.
Wow.
Which is a form of radiation, but that's literally implanted at this relevant
never
point.
heard of it myself, yes.
So what we know about prostate cancer is, again, all about the timing. So you're going for the general check. You don't even need that ugly exam that everybody's so stressed about these days.
Dreading.
You could literally take a blood test.
Okay.
Right. So as part of your screening, when you reach a certain age, we will include it. And you're here, let's say we see something in the brain, right? We're worried. We don't know whether it's your meningioma, it grew there spontaneously, or is it a spread from somewhere else? So we tend to actively look out for that. And what I'm grateful for is that I cannot remember when was the last time where I was the one to diagnose that this secondary comes from the prostate. We are seeing people when they are past the brachytherapy, they've been 5, 10, 15 years thereafter, and they're clean.
Wow.
So prostate cancer is all about a function of timing, very, very important. So
What age would that be when you say timing? When should they start checking themselves?
Latest 45. So if you're in a family where, let's say, you have a family member who has any kind of pathology, you have to obviously consult with your medical professional. They may need to start checking you way earlier. They may need to start checking you in 40, right? But not later than 45.
Wow.
Because we do your PSA. Sometimes it's literally, it could be something as, okay, my stream is not what it should be. Why am I getting these urinary tract infections, or what feels strange, right down there? It's not flowing as powerfully as it used to. I'm sort of not able to empty my bladder that well. It's starting to burn a little bit. It's a bit uncomfortable when it comes out, right? I have to go more frequently than usual. So it can literally be those things that make us start thinking about the prostate. And why I'm saying that the vast majority, sometimes the prostate can overgrow. Remember what I was saying about benign conditions?
Yes.
It's not necessarily cancer. It's just overgrown because it's been around for quite a bit of time.
That word brings a sense of relief every time you go for any kind of test.
Benign. You're not too stressed about it. Yes. So it's literally, I would like to say that the patients that I am seeing that are of a certain age are doing a great job.
Wonderful.
They're doing better and better. We're not going to lie it's similar to women.
Yes.
There is going to be that person who has other priorities, is a bit overwhelmed, etc. But can I be honest with you? Usually women are very prepared and the wife will know more about their husband. But the one patient who defied everything and was my most prepared patient, had the best history, best notes, best everything, was actually a man.
Wow.
So it's possible for men to take very, very good care of themselves. What we do accept is that education is important.
Very.
your being able to access healthcare is important.
Ooh, you can say that again. Throughout the world, actually.
So it's that combination of education and accessibility, which allows you to navigate the health system efficiently and get the help that you need.
Yeah.
And then, as I said before, we take care of you at the preventative end, then you never get to meet a Makhambeni where you have a secondary that has spread wherever.
Yeah.
So I am really, really impressed by the fact that our GPs are doing remarkably.
Wow.
Men are actually speaking
This is
out
quite
more and
promising
more. I'm telling
and
you.
encouraging.
I'm telling you, by the time I see them, remember what I was saying about the pattern of disease, right? When it comes to backs, etc. So I'll see my patient in their 60s, 70s. No, I had sometimes they even forget. Oh, doc, I forgot to tell you that I had brachytherapy however many years ago. I had prostate cancer. They've checked me recently and the numbers are perfect. Those are the patients I am seeing. So we're very encouraged by the fact that this works. It actually works.
That's amazing.
And the urologists have done amazing research and they found a solution that is effective.
Wow.
It's effective.
Love it. Do you ever see rare disease patients of the female and the male with prostate, or the female we've actually covered already with the menopause, a patient living with a rare disease condition and the prostate at the same time?
Yes.
And how do they navigate around that in terms of the survival mode, especially when the prostate is not going anywhere, as well as the rare disease condition they're living with?
You know, the truth be told, remember what I was saying, that the vast majority of people will never meet a neurosurgeon. To some degree, most of our patients qualify as your rare disease patients because it is so uncommon for you to end up having something that is of a state or of a severity that it needs a neurosurgeon's intervention. That's the first thing. Second thing, as I said before, we're very spoiled because urologists have made amazing strides when it comes to getting on top of these prostate issues.
In our country, we're so proud of South Africa.
I'm telling you. So remember the lower urinary tract symptoms that I talked about? Is the stream a bit low? Am I struggling to empty out my bladder properly? Does it burn sometimes now? Does it look like I tend to have these, bladder infections a bit too often? Am I sort of dribbling? So those patients, by the time they very often get to me, they're already on medication that will help alleviate those symptoms. Those are especially the ones who have a benign prostate hypertrophy. So those are the ones with the hypertrophy, hyperplasia rather. So those are the ones where the prostate is enlarged, right? It's not cancer, it's enlarged. Then, as I said before, we have a lot of patients who are post-brachytherapy, post-management of whatever form of prostate cancer, whatever form of appropriate treatment was necessary.
Right.
And again, function of education, they understand that I do have to go and get it's called the prostate specific antigen. I do have to get that checked once in a year, ever so often, right?
Yes.
So they keep up with those small things that mean that they stay healthy. So now that said, you have those sorts of patients who are managing their prostate very well. So not going away. You will have a prostate forever. Fact. Wow. Right?
Is that how it goes?
But it's so well integrated into their lifestyle, or it's so well managed.
Yes.
It's just a matter of touching base now and then. You're going to have your blood pressure checked anyway once a year. You're going to have your sugar and your cholesterol checked anyway once a year. So it's integrated into those checks that
And this is what we
generate.
need to encourage men to go for the test yearly.
Please go.
So important.
Go. Even if you're not 45.
Yes.
Sometimes when people are younger, all of us, right? Your body is a good slave. It's not misbehaving.
Yes.
You have no reason to go and live at a doctor's office. That's okay.
Yes.
When you get to 40, please just go and check. And then they will look at you in context Do you have a family history of colon CA? Is your prostate misbehaving? Did your father have a prostate issue? Does your brother have a prostate issue? Then they will remember we're at an age where it's not a one size fits all. We can actually tailor your screening and your treatment to what you need.
Wow.
So just go check with when you're 40, and 40 looks amazing right now. Hey,
it does. The perimenopause phase.
Other side of 40 looks amazing these days.
Yes.
Right? But we want to maintain that. We don't want the car breaking down. Just go for your service. Let's look at it this way. Let's make it practical.
Yes.
Go for your service. Then you can schedule it.
Yes.
It's convenient for you. We don't want the car breaking down. Then you need people like me. And did you really need to get to me? I don't
Not
think
really.
so. Meet me here.
Yes. Is that true? Oh, I'm loving the conversation. It's important for us to go for a screening on a yearly basis. Women and men, very important. This question, women struggling with fertility and the role that you play on a daily basis. How often do you see these patients, and do they sometimes have a rare condition disease?
Yes.
And how do you navigate around this? How do you help them around to give them hope, because they're still young?
Remember what we said about the pituitary when we actually started?
Yes, the hormones.
Why we love working with our colleagues, we talked about urologists, now they're the gynaes, is that sometimes they screen for us those patients who have those sorts of problems. Something just doesn't click.
Yes.
Doesn't make sense. Your body should be running or function in a certain way, but your numbers are not doing what they should, right? So again, the actual patients, so having a slightly increased size of your pituitary, fairly common. Very few, extremely few fall into the order of those where it's now pathological, where, for instance, your prolactin now is causing you problems and causing your infertility, right? So we need to manage that, and it is amenable to medical management. Obviously, we track and double check that, okay, is it working out for us, yes or no? But what we also know about your pituitary is that it's actually going to also control your cycles literally, right? Your luteinizing hormone, your follicular stimulating hormones. So all those things are important in terms of how well your cycle is running, how well regulated it is.
Yes.
But we also have to ask people to sometimes be patient with them and explain with themselves, and I'll explain why. So you may be taking in exogenous, so as in from the outside, hormones that are part of your mechanism to prevent unwanted or unplanned pregnancy, right? You could be doing that. Now, when you decide to have children, your body sometimes needs a little bit of time to start self-regulating. Because remember what I said, it works on a feedback mechanism.
Yes.
So whatever you are pushing in is somehow feeding a certain set of information, set of data to your pituitary, and then it's acting appropriately. So you have to sometimes give it time to adjust to not having that outside stimulus. And it literally finds its own feet. So that does not necessarily happen in a month or two. You need to be
patient,
kind to yourself, right? It does not necessarily mean that your body is failing.
Yes.
It just means that your body has to get used to not having outside interference with running its own schedule. And that's why your menses may be irregular.
Yes.
While your body is still finding its rhythm, right? So then there's also the challenge that we talked about, mental health, which touches everything. I know that if you are stressed, if you are overwhelmed, if sometimes you are under or overweight, either extreme for you, right?
Yes.
Not a one size fits all. An extreme for you can cause that. Remember what I was saying. I want you to remain active. But if you over exercise,
yes,
your body is going to go, I don't know. Women tend to need a certain amount of body fat, and that specific number is never the same for any two women.
Everybody, yes.
And a typical example of that is that look at South African women's bodies and how we are structured. Look at the rest of the world. You can go to Asia. So you can't assume that a healthy Asian body, a healthy African body, they're not the same. This is where the beauty of tailoring your treatment matters.
It's important.
Here. So we know that if you are in any of the extremes when you're a woman, it can be overwhelming for your body to manage all of that. And primarily, remember, the body is a very good slave. It's going to focus on your health.
Absolutely.
Your having offspring is a second last thing. And it's interesting how your body sometimes is informing us that maybe that's how we should look at all these things. Before I get to having the children, let me be okay. I'm not just talking nutritionally. I'm not just talking in terms of physical exercise, emotionally too. Because it is, we've all heard those stories that when they had given up, when they had decided to go for adoption, then they fall pregnant. Why? The pressure's off.
The pressure's off.
But now when I've put so much stress on myself, right? Now, again, pituitary, there's all this cortisol going on. Suddenly, because of all of that, it's making, because of the stress in and of itself, it can make my cycles a bit irregular.
Yes.
So,
and also adds on the intensity of the relationship that could also turn the whole wheel and the direction.
Instead of it being a supportive environment, now it's a pressure cooker.
Yes.
Because whichever one of the parties is so driven to this, maybe both of you really want this child, but you're stressing about it does not
makes it worse.
Help you.
And the saddest part is that women are often blamed. They're the ones who takes more weight when it comes to conceiving and not conceiving. And we tend to look at their male counterparts in a different way.
That's why I started off by saying that please be kind to yourself.
Wow.
It would be lovely, male or female, if the world was as kind to you as you would like for them to be. But charity begins at home.
At home.
You have to be kind. And if you're kind towards yourself, you have a lot more margin to be kind towards other people.
Absolutely.
And therefore, to some degree, you could generate that cycle of positivity. Whereas we know misery loves company.
Yes.
If you are miserable, if you are angry, you're bitter.
Yes.
You are embittered towards other people, and you actually don't see how you are feeding the negative cycle for them.
Oh, surround yourself with positive people, stray away from toxicity, and go and look deeper into yourself. I always say sometimes that toxic person, it's yourself.
And
so important.
Generally, if you're a little bit kind to yourself, you can be selfish and overindulgent and expect the world to revolve around you. I'm talking about the fact that you have literally just come off of either your injectable or your oral contraceptive. You want a baby right now.
Yes.
Right. You've been on this medication for decades. So your brain literally has to jumpstart now, running its own cycle. You're being so miserable that you're crying at work is only going to make everything worse, because now you start underperforming at the things that used to be so easy and used to, give you joy. Now everything is proper drudgery. Everything is just torture.
Yes.
Because there's just one specific finite thing in your life that is not following a schedule that you would prefer. And what we also learn, remember I was saying that I have to accept that one of my patients says no thank you.
Yes.
I may not agree that it's the best thing for you, but it is your right to say no thank you.
No thank you.
So what that teaches me is that not everything is under my control. And we need to also be clear about our bodies when it comes to that. I do everything I can well. I eat as well as I can.
Yeah.
I exercise appropriately, not too much. Go to your biokineticist to help you find out what is the best level for you.
Your age.
Right? Because sometimes you're doing too much. You've panel beaten yourself into being so perfect that you're not taking into consideration that maybe your body fat percentage for you is too low.
Yes.
And therefore your hormonal complex cannot function optimally. It just can't. It just cannot, because fat is actually part of that balance. Some of it gets stored in fat. Sometimes the fat can convert certain of your hormones.
Yes.
So these things are important for women's bodies.
Very.
What's interesting for me is that sometimes people will not allow their bodies to go through its appropriate developmental phases, but they want the effects of its doing that. Right? You're not allowing yourself
to... We see it all the time. Yes.
You're not allowing yourself to gain weight, but you want boobs. Oh. Do you understand?
Yes.
I'm not saying, remember, it's all about us tailoring it to your balance, right? It's
tailor it to your balance.
It's okay for you to have. I'm trying to beg people to start off by doing the best that they can for them, right? Do the nutritional side, do the physical movement side as well as you can.
And balance the mental health.
Before anything goes on. Yes. Before anything goes wrong. And then when you come see your plastic surgeon, your aesthetic surgeon, when you come see your neurosurgeon, right?
Yes.
We're not actually compensating for something very small that you could have done without our interference.
So true.
Be kind to yourself. Give yourself space to look like you, to be you, not what the world has panel beaten you into needing to be.
Yes.
Be the best that you
version
can be.
Of yourself.
And you're performing, you're in your flow. So therefore, what that means is that you also give your gynae a lot less work because you're less stressed. It's a fact. If you are stressed, if you're overwhelmed, if you're not eating properly for what your requirements are, if you're maybe over-exercising, you will struggle.
You will.
You will struggle. And then you come to me, which is not... I don't wish that on you. We can find a way to help you without going to the extreme of everything. And as I said before, once we've done that, and you still need hormone replacement therapy, we still need to engage in a little bit more support in order for you to conceive. I mean, then I do that with the most joyful of hearts, because I know that I'm not exposing you to unnecessary risk.
Wow. Beauty.
Because all these things have side effects.
Yes.
Let it be, if we're exposing you to something, we've tried to do the low maintenance, the low threshold things. We've done them well. We've taken care of you because, again, if you're healthier, your baby will do better. If you are emotionally healthier, you will carry better. If you're stressed, that's part of the risk factors for your delivering prematurely or preterm. So all of these things, actually, when you put them together, stand you in good stead for you to have a healthy pregnancy. If we don't do that for you, we are already compromising you before you conceive.
Yes.
Because now we have you with the stress, we have you with the poor nutrition, now you conceive, you have an underweight, underdeveloped child, you have potential complications.
Maybe even a thyroid problem somewhere, as you've mentioned earlier.
Because that's why I'm saying that let's start off by let's deal with low-hanging fruit. If we're struggling, you're going to go to your gynae, they're going to see you, help you.
Yes.
Okay, navigate what it is that's going on hormonally that is interfering with your being able to conceive.
And also stop self-diagnosing ourselves, because it happens a lot lately.
If we're being fair, that is usually driven by fear.
Okay.
So when things are not following a script that I expect, and I'm flailing, trying to come up with an explanation for what on earth is going on right now, I have to hold on to something to help me make sense of this reality I find myself in. There's a lot of people where, as I said before, we're not saying everyone. There are some people who genuinely have infertility problems that require our intervention.
Yes.
We're not saying they're not there. They've already done the right things. They've already been kind to themselves. They've already given their bodies time to adjust. That minimum of 6 months.
Wow.
To adjust to having come off of the contraceptives. They're eating well. They're exercising properly. Not too much, but adequately.
Yes.
Right? So they're doing everything that they can to create an environment that is conducive.
Stunning. Wow. So happy we're having this conversation. They've just told us that we're running out of time. Okay. One more last question that I have. Women who are pregnant, they give birth to a child who has a chronic condition. They bring the child to you, only to find that within a few months, the child is now diagnosed with a rare disease condition. Yes. Because of the spine, because this is one of your roles that you work on a daily basis. What happens? What is the most common spine issue these babies present because their bones are affected, skeletal is affected, mobility is affected?
Yes. So one of the more common, again, rare, right?
Yes,
I deal with
rare.
a biased market.
Yes.
Is your spina bifida is one of the most common ways of referring to it, or spinal dysraphism, and there are different levels at which that abnormality can happen in the spine. So it could be an occulta one where we can't see it, it's not obvious, but the tags or there's certain, something is giving you a signal that there's something going on there. And then there's an overt version where you can literally see from the outside that, okay, we're dealing with this type of problem. It can have downwind complications where there is an issue with the development of the lower limbs, with controlling your continence, right? You're controlling number 1 and number 2.
Yes.
Sexual dysfunction as well. And this can start early. And there's some of them, as I said, the occulta version, where no one actually knows there's a problem. It's been there your entire life. Suddenly manifests when you are an adult.
Wow.
So, as I said, this is now your true rare condition. But because I deal with the bias market, that is what we see.
What you see.
So you can have those instances where no one actually knows to look out for it because it does not manifest itself. And then suddenly as an adult
shows up.
The legs are
hence some of the adults are only being diagnosed at a very late age.
At a very late age. That's the nature of medicine. Some things will manifest quickly and aggressively. Some things will take a lot of time because, as I said, body, very good slave. So your body can be a better slave when it comes to certain things, and maybe your specific body cannot accommodate other things as well as it would like for you on your behalf. And then with that condition, we also have to actively exclude something called hydrocephalus, because the flow of CSF, so that's a fluid that goes into the spine, is related to what's going on in the brain. And if there's an accumulation there, that's where now it becomes also a brain disorder. But hydrocephalus can also happen on its own.
I'm happy we had this conversation. Babuyel, you've heard what the doctor said. Let's change our lifestyles. Let's get ourselves tested on a yearly basis, especially when you reach the age 40, things changes drastically. We can never just nail it to one thing. It can be, they're multifaceted, right? So, Dr. Wilheminah, I would like to say thank you. We can speak and speak and never just end it, but I'm so happy because from here, I'm still going to educate, even my kids, because we talk about health all the time. One more last thing I would like you to share with us. 5 tips, even if it's 10 from your own mouth. What would you like to tell the audience, someone who is watching? What is it that they should start doing from today? And what is the importance and the relevance of it?
For all of the 5, understand that it's never too late to start. It's never, ever too late. So, number 1, eat what you understand. We're not even going to go far.
Yes.
Just a little bit of common sense. What is healthy? Start there. And if you're struggling with that, again, do it bite-sized pieces. Start with your breakfast today. Next week, correct your lunch. The following week, correct your supper. Maybe you know yourself that your portions are too large. Maybe start off by having separate, smaller portions. Again, use your dietitians, right? So start off with common sense things, fixes. Go to your professionals because you've already broken the psychological barrier between your being able to do healthy things and difficult things and your being able to do what you know you should. Yes. So, common sense, visit your dietitian, get moving. 30 minutes a day, 3 times a week, you are a superstar. Moderate exercise.
Wow.
You're not there, starts 10 minutes a day. I'm proud of you.
Yeah.
Add on a minute as you go. You've started moving, visit your biokineticist now.
I'm going to encourage my patients and clients as well to do that.
Are you having aches and pains because you're maybe straining yourself, or is it genuinely just your body getting used to getting stronger?
Yes.
Right? Use your biokineticist. When in doubt, before the age of 40, you have a GP at your disposal. They are our finest tool of finding out about you if there is a serious problem, right? I don't say that there's anything wrong with doing a bit of research and being educated about your own body. Very important. But none of us has objectivity when it comes to ourselves. I also see a doctor myself.
Yeah. Because I'm happy you mentioned that.
I'm 100. Listen. I cannot look at myself objectively and give myself the best potential treatment that there is. So use your GPs, please. Use your GPs. And remember, as you're doing all of these things, not only is it never too late, just be a bit kind to yourself.
Wow. Be kind to yourself and be patient with yourself, mentally, physically, and spiritually. Thanks again, Dr. Wilheminah. And don't forget to click on the button and subscribe and follow more for more different conversations that we're going to have on the podcast. Khobe's Health Century Podcast partnered with Rare Disease South Africa. Thanks for watching.